Hello, welcome to the Inland Coalition on Aging's live stream on the Inland Empire Master Plan for Aging. Today we're going to be discussing Mental Health Awareness Month and Older Americans Month, both in month of May. My name is Elizabeth Bogomil and I'll be your host for today. I've served as the consultant for the Inland Coalition on Aging for the last 2.5, 3 years. And as part of that role, I've conducted the needs assessment, helped facilitate working groups, engaged in stakeholder and community outreach, and in building stakeholder partnerships and finalizing the forthcoming Master Plan for Aging, which is going to be released in June. So stay tuned. I'd like to welcome our guests and invite them to give brief introductions on themselves, their organizations, and what their organization does. First, we have Maria Atruya. She's the regional manager at the Riverside Office on Aging. Maria, would you like to tell us a little bit about yourself and your organization?
Thank you, Elizabeth. Good morning, everyone. My name is Mia Atruya, and I work with the Office on Aging. We are a county department that serves our older and disabled adults with various programs. Thank you.
Wonderful. Thank you, Maria. Or Mia. Next, we have Sage Downs. Sage is clinical director for the Inland Caregiver Resource Center. Would you like to tell us a little about yourself and about the Inland Caregiver Resource Center?
Yes, so I have been with Inland Caregiver Resource Center, what seems like for a very long time, almost 10 years, and we do a wonderful job at providing services for family caregivers who are caring for their loved ones who have a cognitive related diagnosis after the age of 18, or they're caring for somebody over the age of 60 with assistance of day-to-day activities of daily living.
Thank you, Sage. And then finally, we have Robin Schlosser, who is the Executive Director of Reach Out Morongo Basin. Robin, would you like to tell us a little about yourself and your organization?
Oh, certainly. Good morning, Elizabeth, and good morning, everyone. I am Robin Schlosser. I'm the Executive Director for Reach Out Morongo Basin. I have been with the organization, it'll be 15 years in September. We provide a variety of services here in our rural area for low income, senior, and disabled individuals. We have senior support services programs. We do family caregiver support services programs. We have fall prevention programs, uh, emergency assistance, which is an out of the box fund for all kinds of things like swamp cooler repairs. And we also have a transportation program that is open to anyone 18 and over, because that's one of the greatest needs in our rural area is transportation and support in homes. So, and that's what we do.
Wonderful. Thank you all so much for sharing a little about your organization and yourself, and we'll learn more as we go through the live stream. First, Mia, tell us a little bit about what Older Americans Month honors. I think you're
This
on
is
mute.
on. Oh, my goodness.
Oh, you're good now.
Okay. Sorry about that. So, Older Americans Month is a time to recognize older Americans' contributions, highlight aging trends, and reaffirm our commitment to serving older adults nationwide. For the past 50 years, the Older Americans Act has been a vital federal program that enables the local delivery of services and supports to connect older adults and their caregivers to services that will help them age with health, dignity, and independence in their homes and communities, which is usually where they want to be. This year's Older Americans Month theme challenges us to flip the script on aging by focusing on transforming how society perceives, talks about, and approaches aging. So, throughout the month of May, Riverside County Office on Aging has held several outreach events honoring older adults' contributions, exploring the many opportunities for staying active and engaged as we age, and informing about the numerous services available to older adults and highlighting the opportunities for purpose, exploration, and connection that come with aging.
Thank you so much, Mia. This month is also Mental Health Awareness Month. And Sage, can you share a little about the mental health issues that older adults face?
Most certainly. So something that we see commonly within the Caregiver Resource Center is a very high numbers of depression and anxiety as individuals are aging. And some of these sources of depression and anxiety can come from many different things, such as isolation, grief and loss, not just losing individuals physically, but the loss of maybe their job, their independence, living independently as well, not just their physical health and independence too. So there's many reasons why individuals may experience mental health diagnosis, but most importantly, something that Inland Caregiver Resource Center really does focus on is the burden that also takes place with caring for older adults too. Because not only is the family caregiver experiencing stress, but the person receiving that care is also experiencing that stress and that anxiety of having to rely on somebody. So there's a large variety of mental health diagnoses that are prominent in the older adult community. And also reminding ourselves too that some of these older adults also have long-standing mental health diagnosis as well that were maybe treated and managed maybe on the successful side when they were younger, but as they're aging, it may not be as easy.
Thank you so much, Sage. Robin, we know that Riverside and San Bernardino have rural areas within the counties. Based on what Sage said and your experiences, are these mental health challenges in older adults amplified in rural communities, and what do they look like?
I absolutely believe that they are amplified here. Our service area here in the Morongo Basin is about 1,800 square miles, and there are only two incorporated communities in that region. Um, we have clients for ourselves that are 25 miles outside of town and 5 miles down dirt roads, and they have no resources for access to mental health services. They don't have neighbors to even talk with. They're very isolated. Many of them have no family or support. So when we're working with them, we're trying to address those issues. The isolation. I mean, we have one of our services is we pick them up and we bring them to grocery shopping and social services and the senior centers because we operate the 29 Palm Senior Center. So we really try to have activities for family caregivers because we do an out of home daycare program here. And then we also bring in seniors so that they can socialize and have activity or communicate with their peers, have activities that are age appropriate and things like that. Because it is something that we see a lot of. They're depressed, they have no one to call, and we're in many cases it. We have some people that, with our transportation program, our drivers and the people that they get to ride with are the only people that they see. So we have seniors that will call just to chat with us, which because they don't have anything else. So yeah, it is definitely amplified in the rural areas, and we do what we can, and we hope that we can receive more funding and more focus on these areas here, so we can bring more help in.
Thank you, Robin. Um, when we were doing our needs assessment, we spoke with community members who are aging and disabled throughout Riverside and San Bernardino counties. And we heard about their experiences, and a lot of their experiences are paralleling exactly what y'all have communicated. There's a lack of being able to uh, do activities with your neighbors sometimes. There's mental health issues because of that. Transportation issues united a lot of the challenges that were faced by individuals that we spoke with. Um, but we also noticed in this needs assessment, one of the most key findings was there was simply a lack of awareness of the resources that were available. The resources for mental health and behavioral health, the resources for long-term services and support so that people can stay within their homes and age within their communities. And so there was a lack of knowledge of what was available and how to take advantage of those. Um, And so the next three questions are for our guests, and hopefully we can bring some of this knowledge of how to access these resources to the community. What are some of the programs that your organization provides? And I'd like to start with Mia.
Thank you, Elizabeth. So the Office on Aging provides a variety of services for our communities. One of our primary services is Information and Assistance Call Center, where we can provide details on programs, services available, as well as provide referrals and linkage to particular services within the county or community-based organizations. We offer programming on nutrition, whether it's home delivered meals or congregate sites, referrals and information on transportation services, health insurance, housing information and support programs. We also provide case management programs that support family caregivers and aging adults. We also provide information on care management, volunteer opportunities. So just a variety of services to meet the older adult as well as their caregivers.
Thank you, Mia. Is there a good way for community members, if they think they could use a service that y'all offer, to reach out either by phone or by online?
Yes, so we do have our website, rcaging.network.com, and that is a quick way to get information. You can also connect to us through that website. Our call center is in operation Monday through Friday from 8 to 5, and that's an excellent way to speak to a live social services agent that can provide information and assistance for a variety of programs as well. I don't know if it's appropriate to share our phone number at this time for that or not.
If you have it and you want to share it, you're welcome to. Otherwise, we can
Yeah,
direct people to the website.
absolutely. So our call center number is 877-932-4100.
Wonderful. Thank you so much. And hopefully, if people can take advantage of those resources, they'll reach out. Sage, what are some of the programs that Inland Caregiver Resource Center offers to community members?
Mm-hmm. Right. And so we target two different communities. We offer services for the family caregivers and individuals who are over the age of 60. So I'll first start off with our services for the family caregivers. So we do provide long-term case management programs where we can provide emotional support or education on what it's like to care for dementia or whatever diagnosis that their loved one that they're taking care of experiences. And we also provide support groups, educational classes, and also have fun social activities such as conferences where our caregivers can get together and socialize with one another. We also, for our senior services, so for those over the age of 60, we do have limited in-home services as well, where somebody's able to come in and provide, maybe like household cleaning, personal care, or even companionship, because seniors definitely do thrive from companionship. And also, we have three really great mental health programs. Going back to the family caregiver services, we have our short-term counseling program that is free for our caregiver clients to use. We're at 6 to 8 sessions that focuses on just family caregiver concerns that they would like to address. And for those over the age of 60, and this can include individuals, especially caregivers who are over the age of 60, where we have two programs. One is called Pearls, which stands for a program to enrich active and rewarding lives for seniors. And it's a problem solving model. So especially if somebody says, I'm feeling really lonely, I want to socialize. A Pearls coach is actually able to step in and say, okay, what can you do to decrease these feelings? And then lastly, we also have Thrive, which is our cognitive behavioral therapy program that is 16 to 20 sessions. I was going to say 16 to 80. That's a little long. But 16 to 20 sessions where it's just focusing on thoughts and feelings that the individual is having. And I realized I also forgot a major service that is highly requested for our family caregivers program, which is our respite program, where we provide a short amount of or a small amount of hours for a short period of time to give that caregiver a break too, because caregiving is exhausting. And and how can clients reach out to us? There's multiple
Mhm.
ways. Individuals can look at our website at www.inlandcaregivers.org, and they can apply for our services online. We have a wonderful system called Care Navigator where people complete their intakes online, which is really great, especially for those over the age of 50 that are more open to applying for things online, or even our younger caregivers. We also have our office hours from 8 to 5 Monday through Friday, and our toll free number is 1-800-675-6694. And that's
Wonderful.
ICRC in a nutshell.
Thank you so much, Sage. All those resources sound really valuable, especially the respite care, which has been something that came up in a lot of our discussions with older adults in the community. And Robin, what are some of the programs that Reach Out Morongo offers? You kind of summarized a few, but if you want to go more in depth, and then how
Oh,
can we
yeah.
connect with y'all?
We really proud of a lot of the things that we do. So we are contracted with the county of San Bernardino with several different several different funds. So we do Title 3B, which is the Senior Support Services programs. We do homemaker assistance, which is personal business assistance and some in-home housekeeping, various programs like that. Um, Chore assistance, which we collaborate with the local Marine Corps base for volunteers. They go out and they help do yard work and such for seniors. We do the senior center operations, which we oversee the operations of the 29 Palm Senior Center. So we do activities, oversee the lunch programs. We have part of that is we do with the caregiving. We have out of home daycare program where we will go and pick up care recipients, or the caregiver can bring their loved one here to the senior center, and they can come in for activities and socialization in a safe and supportive environment so that the caregiver has some time to themselves also. So that's our 3B. We do family caregiver training and respite out of home day, some in home respite, peer counseling, peer support groups, assistive technology. We can help them with different medical devices if they need that for in home, and also some home modifications. We can come in and do if they need shower work, grab bars, wheelchair ramps, things like that. We do the Aging in Place program, which is another county grant that we got. And that one is we're able to assist with, again, medical equipment, lifting recliners, because that purpose of that is to help people age in place and not have to be institutionalized. So we're able to help them with walk in showers again and things that are out of the box that a lot of people don't get. Lifting recliners has been one of the things that people have been absolutely ecstatic about. We do art therapy in conjunction with the Alzheimer's Association of the Coachella Valley. We do art therapy groups once a month for seniors here at the Senior Center. We do a community supplemental food program, which is a collaboration with the 29 Palms Community Food Pantry and Find Food Bank, where we distribute 240 commodities boxes, fresh produce, and cheese every month. 100 of those are delivered because we have our transportation program. So we deliver to shut-in seniors throughout the basin. We have an emergency aid program. That was another funding that we received from Scan Health Plan. So that helps us with out of the box programs. We can help with shelter assistance. If we have a senior that has found themselves homeless, we can put them in a motel room. We can pay a utility bill. We can do some small repairs on their homes. A variety of things that aren't covered under anything else. We're able to access this to help with that. Our transportation program, which of course is our largest program, and we provide transportation to doctor's appointments throughout the Morongo Basin as well as to San Bernardino, the Loma Linda VA. We go as far as Arrowhead, and we go to the Coachella Valley 5 days a week. We take them through Desert Regional all the way down to Indio. We also up in the Morongo Basin, we take them to the grocery stores, post office, banks, errands, senior centers, any of the destinations that they need. Because again, we're so rural, many of our clients can't access Ready Ride or public transportation, and they have no other means of rides. And then again, we have their senior center. I think that's it. There might be something
Just
else.
a
I
few.
think that covers most of it. And people can look up a lot of our programs and services. They can go to our website, which is www.reachoutmb.org, and they can call us. We do have two offices. We have one in the 29 Palm Senior Center. Our phone number here is 760-361-1410. And we have an office in Yucca Valley, and that phone number is 760-369-8671. And they can reach out to us to sign up and get services with us. So thank you.
Wonderful. Thank you all so much. And especially thank you for sharing those phone numbers. That was something when we talk to community members, they really appreciate being able to contact people directly and talk on the phone to learn about the resources offered. Some of them don't have reliable internet, so that's a situation to consider. So one of the main findings that we found through our needs assessment was that many people are not aware of the services available in their community. How do people find out about your services? We talked about that. And what is the process for obtaining services? Is there are they only allowed to receive services if they're in a particular county or meet a particular age range? I know, Sage, you talked about the 60-year-old cutoff for the aging adult services. But who can receive services from your organization? We'll jump to Mia.
Okay. So our primary focus are seniors age 60 and older. We do also serve disabled adults from 18 to 59. And there are various qualifying criteria depending upon the program. So when a person calls into our call center, our aim is to complete a whole person health score assessment. And that helps us get an idea of what the needs are so we can properly direct you to the services and resources that will best fit your needs. Again, it just varies depending on the particular program, but we invite anybody to call so we can provide information and direct you appropriately, even if it's not a service within our agency that we're going to directly to provide for you. We are able to reach out to our network and share what would be the most appropriate place to link you to.
Wonderful. And so you primarily serve individuals within Riverside County exclusively?
Correct. Riverside County
Okay.
is our focus. Yes.
And one other question, which I know is important for the region, is documentation status important or something that needs to be disclosed when reaching out for services?
It does not need to be disclosed to receive information and services from our program.
Wonderful. Thank you for sharing. Sage, who is able to receive services from your organization, and what's the process for getting those? Is there an intake form? How does one receive services?
Hmm. Right. And so for somebody to be eligible to receive our services, they must live in either Riverside, San Bernardino, Inyo, or Mono County. So we serve 4 counties. And because we serve such a large area, we don't require a paper intake form to be completed. Uh, Individuals can be called in or call in and request an intake to be completed over the phone. And if the person is wanting to, we can do it over Zoom, especially if they have the internet access available. So that way they're able to get that connection. And we can do an intake and refer them to other resources or provide vouchers with specific services that they're wanting from us. For our caregiver clients, after the intake is completed, and if they're interested in our family consultation services, which is our long-term case management support system, so that way we can meet with a designated worker and just ask more about their caregiving situation. What is their biggest concern, and develop a care plan. So that way we can also help the client navigate through their caregiving situation. there's been a lot of requests for these intakes and these assessments to be completed over the phone because we're still coming out of the COVID pandemic, right? And these individuals are taking care of somebody who's very ill, so they don't want to expose individuals. So phone is definitely an option, but we can do in person if the person is requesting it along with their location. And we're also very open to telehealth services if they're wanting that as well.
Wonderful. And does the individual's documentation status or the status of their family members or who they're caring for matter in this situation?
No, it does not.
Okay, wonderful. And then Robin, Morongo Basin's huge. Maybe you could let us know a little about the parameters of the community and how community members are considered within Morongo Basin. Um,
So, yeah, it is huge, and it depends on the program. Most of our programs are, of course, geared towards seniors 60 and over. Some are geared towards individuals that are disabled, and then others, like our transportation program, are open to any adult 18 and over that needs transportation to the store. We're not going to tell people they can't go to the store, they can't get to the doctor. If you're 18 and over and we determine that you don't have means, we're of course going to help you with that. Um, we do intakes over the phone. As Sage was saying, COVID really had to open that up because we used to do all in-home assessments. Some of our programs do still require in-home assessments. That's like our aging in place program. If we're doing home modifications and things like that, we will go and do an on-site assessment and an inspection of the home to determine what it is we're doing. Um, and then we also open that up as when we're doing the assessments, we do take the time to talk to them. What services are they looking for? If it's something simple, well, we want to start doing rides. Okay, well that's fine. We'll set that up. If it's caregiving and they want more, if they're looking for in-home respite, are they looking for more counseling? It all depends on the individual case. They're all different. I'm sorry, my light just went off. Um, so yeah, it just depends, but we do some because I mean our as you said our area is huge, so it just depends on where we're at.
Wonderful. And so Morongo Basin is, just so we have a geographic understanding and people can know if they fall in that region, it's north of Joshua Tree National Park, right?
It is north of Joshua Tree National Park. We encompass the communities of Wonder Valley, which is like 30 miles east of, it goes about 30 miles east of 29 Palms. We service all the way to Morongo Valley, which is just east of Palm Springs, and north to Johnson Valley, which is about halfway to Victorville in Apple Valley. So it's a huge area.
It definitely is. Thank you so much for sharing how people can engage more with your resources. As we've been working, the Inland Coalition has been working on this master plan for aging for the Riverside and San Bernardino region. We talked a lot about the need for collaboration with partners like yourself and with other partners as well. I was hoping that each of you could talk to us a little about why collaboration is important and helps us meet the needs of older adults in our communities. And we can start with Mia.
So collaboration really is key in being able to provide effective services for our older adults. Just understanding that the needs of older adults can be so complex, it's multi-layered. And so having that understanding of what services are provided by our partner agencies that we can use to complement the support that we're hoping to give to our older adults. It's also helpful for us to build those relationships so we know who we can reach out to and count on because we're all serving the same population. We're all reaching for that same goal. So that collaboration is just so vital to ensure that we're not duplicating, but we're supporting and really complementing the services of each other.
Thank you, Mia. Sage, do you have some additional ideas to contribute?
I just would like to point out that I love the fact that Mia said to complement our services, right, and to meet the client's needs, because that's exactly what my answer was going to be. And and another reason why collaboration is so incredibly important is to help build trust within the community. If we are providing reliable resources through the connections from collaboration, then the community would be able to trust us and other organizations a little bit more as well.
Thank you, Sage. And Robin, your organization is very unique because you are contracted with the county. And so that's a form of collaboration as well, along with all the other organizations that you've worked with. Why is
Well, with,
collaboration important to Reach Out Morongo?
well, I mean, it's important because it allows us to serve more people and in different ways, because I mean the needs that we have out here are very unique in many ways. I mean, we don't have the resources that other areas have. We don't have as many businesses, as many other supporters. So our collaboration with the county, our collaboration with Caltrans, because we have a Caltrans 5310 grant that we collaborate with the Morongo Basin Healthcare District for transportation services. That allows us to combine our vehicles and our drivers to serve even more clients. And it helps to meet the needs here. Our collaboration with the food bank, the local community food pantry, helps us serve 250 seniors every month with additional food services that they would not be able to have to help meet their needs. The Alzheimer's Association complements their services. They come up and they do programs here at our senior center, which is something that is not available in our region. So collaborations are extremely important because we're able to bring in new ideas, new services, things that would not otherwise be available here.
Thank you so much, Robin and Sage and Mia, for sharing about collaboration. We're definitely hoping through the new Inland Empire Master Plan for Aging that we can encourage further collaboration to build out a community that is supportive of those who are aging. Thank you all for listening to the Inland Coalition on Aging's live stream on the Master Plan for Aging and learning more about Mental Health Awareness Month and Older Americans Month. And thank you to our wonderful guests, Mia Atria from the Riverside County Office on Aging, Sage Downs from the Inland Caregiver Resource Center, and Robin Schlosser from Reach Out Morongo Basin. If this is your first time tuning in, check out the other live streams on YouTube introducing the Inland Empire Master Plan for Aging, discussing transportation, behavioral health, caregiving and Alzheimer's, long-term services and supports, which was a lot of what we talked about today, behavioral health, equity, and local resources. If you'd like to receive updates on the Inland Empire Master Plan for Aging or updates from the Inland Coalition on Aging, please visit inlandaging.org to sign up. I've got the website right there. And join us next month for our live stream on June 24th for the official launch of the Inland Empire Master Plan for Aging. We'll be launching it, and this is open to the public, and it'll be online. We look forward to seeing you all there, and then also hopefully seeing some of our guests today there too. Thank you all, and have a wonderful day. Bye.